Neurofibromatosis. Neurofibromatosis, also known as NF, was discovered in 1882 in Paris, France by German pathologist Frederick Daniel von Recklinghausen. NF refers to two genetically distinct disorders. NF1, which affects the peripheral nervous system, and NF2, which affects the central nervous system. NF1 effects can include visual impairment or blindness, optic glaucoma, Lisch nodules, speech impairment, seizures, headaches, brain tumors, brain blood vessel defects, learning disabilities, mental retardation, oversized head, high blood pressure, café-au-lait spots on the skin, and neurofibromas, which are tumors of varying sizes and can occur anywhere on the body, freckling where skin meets skin like under armpits, groin, under the breasts, earlier delayed puberty, scoliosis. NF may cause pain, vomiting, chronic constipation, or diarrhea. False joints, bone deformities. Other complications may include delay in learning to talk or walk, short stature, poor school performance, increase in size and number of tumors during pregnancy, severe itching, psychological burdens, and cancer. NF2 effects include cataracts at a young age, meningioma and other brain tumors, hearing loss and/or deafness, bilateral vestibular schwannomas, acoustic neuromas, spinal tumors, schwannomas of the peripheral nerves, and skin tumors. Balance problems and general muscle wasting can be associated with NF2. Both NF1 and NF2 are considered to have an autosomal dominant pattern of inheritance. NF1 is linked to chromosome 17, and NF2 is linked to chromosome 22. Symptoms of NF include several or 6 or more café-au-lait spots, or multiple freckles in armpit or groin area. Small growths in the iris of the eye called Lisch nodules normally don't affect eyesight. Neurofibromas, or tumors on or under the skin, which sometimes deep within the skin, harmless but in rare cases can be malignant or cancerous. Bone deformities, including a twisted spine, also known as scoliosis, or bowed legs. Tumors can grow along the optic nerve, which can cause sight problems or blindness. This can be tricky for surgeons because they have to find a way behind the eye and remove the tumor safely. Symptoms for NF2 include loss of hearing, weakness in muscles of face, dizziness, poor balance, uncoordinated walking, and cataracts at an unusually young age. Living with NF can be challenging, especially for children, with the pressures of having good grades with the possible learning disability and the pressure of trying to make friends that will accept you for your disease and deformity. Some people decide to shut themselves out from society because of low self-esteem and no self-confidence because of their disease. Others go out and try to find friends that will accept them for who they are and understand the disease that they have. But for certain people, all they need is their family members. In today's society, 1 in 4,000 people will get NF1, and 1 in 40,000 people will get NF2. 3 to 5% of people with NF2 have cancerous tumors. Both men and women are affected by the disease equally. There is no ethnic group that is more likely to have NF. It can really happen to anyone that has a parent that carries the gene or anyone that has a mutated chromosome 17 or 22. Some people are diagnosed with NF1 or 2 at birth, but with recent studies, symptoms occur between ages 3 and 16. There is no cure or treatment for NF, but people can have surgeries to remove the neurofibromas, but it can be tricky because tumors can be located in the brain or other parts of the central nervous system. Diagnosis is made on clinical grounds. You are diagnosed with NF1 if you have 2 out of any of the symptoms, and NF2 if you have a family history or any of the symptoms. Current research is focused on understanding the natural history of NF2 tumors and determining possible factors that may regulate the growth patterns. Ongoing research continues to discover additional genes that appear to play a role in NF-related tumor suppression or growth. Thankfully, there are online support groups like dailystrength.org, and for more information on NF1 and NF2, you can go to nfmidatlantic.org, which offers online live chat support groups.